Mr. Speaker, in Illinois, the spring rains have meant that less than one-half of the normal amount of corn have been planted this year. We're seeing catastrophic floods, record-setting tornadoes, longer and more devastating fire seasons. Climate change is not a future threat. It's a threat now, and we need to take urgent action. The decisions we make today will determine the future we leave to our children. We also need to prepare for the consequences of climate change, which are already affecting our environment, our infrastructure, our economy, and yes, even our health. More frequent intense heat waves are leading to higher rates of heat stroke. Warmer temperatures are also directly affecting vector, food, and waterborne diseases and causing longer allergy seasons. We need to understand and prepare for these changes. That's why I led a letter to the House Appropriations Committee urging support for the Centers of Disease Control and Prevention Climate and Health Program to help our city and state health departments address and prepare for the effects of climate change. I am pleased that funding for their important work has increased to $15 million in this year's bill. I urge my colleagues to support this provision to help vulnerable communities adapt to the health threats of climate change. And with that, I yield back.
For what purpose does the gentleman from Illinois seek recognition?